is the kind of system-generated report that you need. This report on the screen provides findings at the provider level. For an ABA review where there were 548 claims reviewed for 28 members for 1 year's worth of service. I really want to highlight this finding related to treatment planning. You'll see it right there under the magnifying glass. You'll see that almost every claim, 540 claims, were cited because the treatment plans had no baseline measurements or progress was not documented. I'm actually going to ask our BCBA, Christina Nicholas, to weigh in on this specific finding and why it's so important. Christina, why are baseline and progress measurements so crucial for ABA services?
Sure, Angela. So as we know, measurement of behavior is an essential component of ABA. And I can see people wondering, is it really that important? Yes, it is absolutely that important. Let me tell you why. A baseline is fundamentally a quantifiable measurement of behavior that has not been affected by treatment. And the importance of a baseline is established in a comparative analysis between behaviors that have not been impacted by behavioral interventions or strategies to measurements of behavior that have been. So without comprehensive, quantifiable data across an individual's skill levels, we are just essentially unable to show measurable progress on any skills that we're trying to increase or behaviors that we're trying to decrease. It is impossible to support medical necessity and appropriate service utilization without a quantifiable baseline measurement. As without one, we're just unsure of whether ABA therapy has made a difference at all in affecting behavior change. I know that ABA is designed to see member outcomes, and when it's done right, there'll be no doubt that members are making progress in treatment and receiving the right amount of services.
Wow, thank you, Christina. You know, from our perspective, a health plan should be very concerned about a provider like this. This provider billed a substantial amount in a year. You can see over $1.8 million, and it does not appear that they have a process in place to collect baseline measurements or report on progress. This is that big picture feedback that I was talking to you about earlier, feedback on how a provider operates. You know, as Christina said, how are they supporting medical necessity for this service? We talked about how important this service is for this population. It is a lifeline, but it's also extremely expensive. And if an agency providing ABA services is not adequately collecting data, how do you even know that the services are necessary? Or if they are necessary, how do we know that these members are making any progress? This is a true disservice to these children, to these families. Without a thorough review of the records, it would be impossible to know that this provider was not providing appropriate ABA services. Thank you, Christina. Appreciate it.